Hey everyone, welcome back to the channel. Today, we're diving into a topic that affects many people but isn't often talked about enough: vaginal dryness and painful sex. If you've ever experienced discomfort or pain during sex, or if you've been curious about what might be causing it, you're in the right place. We'll talk about what's happening in your body, why it might be happening, and what steps you can take to fix it. Before we dive in, don't forget to subscribe and hit the bell so you never miss an important video like this one. Alright, let's get started. Vaginal dryness is a condition where the tissues of the vagina become drier, thinner, and less elastic than usual. It can cause discomfort or pain, especially during sex. Typically, vaginal dryness happens when there's not enough natural lubrication in the vagina. Now, it's important to know that lubrication is crucial for making sexual activities comfortable. It also helps protect the vaginal tissues from friction, which is why a lack of it can lead to irritation or pain. So, why does vaginal dryness happen? Let's break it down. There are several reasons why vaginal dryness can occur. Let's go through the most common ones. 1. Hormonal changes. One of the most common causes of vaginal dryness is hormonal changes, particularly a drop in estrogen levels. This is why many people experience dryness around menopause. During this time, estrogen decreases, and as a result, the vaginal tissues can lose moisture and become more fragile. 2. Postpartum. After childbirth, especially if you've breastfed, your body may produce less estrogen, which can lead to vaginal dryness. 3. Medications. Certain medications, especially antihistamines, antidepressants, or birth control pills, can reduce natural lubrication. So, if you've recently started a new medication and noticed vaginal dryness, that could be the culprit. 4. Stress and anxiety. Psychological stress can also affect your body in ways you might not expect, including reducing natural lubrication. Anxiety can affect your sexual arousal, which can make it harder for your body to produce enough lubrication during sex. 5. Infections or conditions. Certain vaginal infections like yeast infections or sexually transmitted infections, STIs, can cause dryness, irritation, or pain during sex. Similarly, conditions like vaginitis or autoimmune disorders can also affect vaginal health. 6. Aging. As we age, natural lubrication can decrease, especially after menopause, which is often a natural part of aging. So, vaginal dryness can cause painful sex, but let's get a little deeper into what painful sex is, medically called dyspareunia. Dyspareunia is a term that refers to pain during or after intercourse. This pain can be anywhere in the pelvic area, and it's often described as burning, stinging, or aching. It's important to note that painful sex is common and can happen for many reasons, not just dryness. But when dryness is the cause, it's usually felt as a result of friction or irritation from lack of natural lubrication. Alright, now that we know what's going on, let's talk about how to treat vaginal dryness and painful sex. There are a variety of options that can help, depending on the underlying cause. 1. Lubricants and moisturizers. The first thing you can do is use a lubricant during sex. There are plenty of water-based, silicone-based, and oil-based lubricants that can help reduce friction and make things more comfortable. For ongoing dryness, vaginal moisturizers can also be really effective, as they hydrate the vaginal tissues. 2. Estrogen therapy. If your dryness is related to hormonal changes, like menopause or postpartum, estrogen therapy might be an option. This can be in the form of vaginal creams, rings, or tablets that deliver localized estrogen to the vaginal tissues. 3. Vaginal DHEA. DHEA is a hormone that can be converted into estrogen in the body. Vaginal DHEA suppositories have shown promise in treating vaginal dryness, particularly in postmenopausal women. You'd need a prescription for this, so talk to your healthcare provider. 4. Lifestyle changes. Managing stress is key. Anxiety or stress can contribute to vaginal dryness. Engaging in regular exercise, practicing relaxation techniques like deep breathing, or even doing yoga might help improve circulation and hormone balance, which can make a difference. 5. Consult your doctor. If your symptoms are persistent or severe, it's essential to see a healthcare provider. They can help identify the exact cause and recommend appropriate treatments. Sometimes painful sex can be due to more serious underlying conditions, like endometriosis or pelvic floor dysfunction, so it's crucial to get a proper diagnosis. While it's normal to have occasional vaginal dryness, if you're experiencing pain regularly during sex, or if dryness is affecting your quality of life, don't hesitate to reach out to a healthcare provider. Whether it's a gynecologist, sexual health specialist, or even a therapist if anxiety is involved, they can help find a solution that works for you. It's important to remember that you don't have to just deal with it. Thanks for joining me today. I hope this video helped you understand vaginal dryness and painful sex better, and gave you some insight into how to fix it. Remember, you're not alone in experiencing this, and there are plenty of ways to get relief. If you found this video helpful, don't forget to give it a thumbs up, subscribe, and share it with anyone who might benefit from it. And as always, feel free to leave your thoughts or questions in the comments below. Until next time, take care of yourself and your body.